Thanks for joining me again with my Healers interview series. Today, I am really excited to introduce you to Noemi Toth, who works with the Aspen Ketamine Center and uses ketamine infusion therapy for mental health treatment. I think you're really going to like the way that Noemi talks with such skillful intelligence about what she does using her background as a CRNA, which is a nurse anesthetist, and talks about how the ketamine infusion process is very powerful and can also be incredibly helpful for treating mental health issues like anxiety, depression, and others. Please don't forget to subscribe to the channel so you can get all kinds of the goodies on here. All right, I'll hand it off now to my interview with Noemi Toth. Hi, Noemi. I'm so excited to have you here with me, and I'm really thrilled to have the opportunity to learn about ketamine infusion therapy. So, thank you for being here.
Hi, Kate. Thank you so much for having me on. This is really a pleasure, and I'm so excited for today.
That's so great. I'm excited to talk about ketamine, but first, I would just wonder if there's anything that you want to share with our viewers about you, just a brief little background into your story and how you came to where you are.
Certainly. So, my background is actually anesthesiology. I'm a nurse anesthetist, so a nurse practitioner, highly trained in anesthesia, also known as a CRNA. And I also find mental health to be extremely important, mental wellness in particular. And there's some anxiety in my family that I've been a witness to the struggles to it, and especially with my sister, and her and I are very close. And um, when I learned about how helpful ketamine has been in research studies back in 2016, I thought that my background in anesthesia, which ketamine is an anesthetic, is a really nice bridge between the two. And so originally I'd partnered up with a psychiatrist and another anesthesiologist, and we started a first ketamine clinic in South Florida. With our first patient, I saw a massive difference. So I knew that this was something that was going to be revolutionary for a lot of people. My life ended up taking me to Colorado. Wanted to be closer to my sister who lives in Denver now. And I'm very fortunate and thankful to be living in Aspen and working here and bringing ketamine to this community in a different capacity. So yeah, that's kind of how I got here.
Thank you for sharing all of that. So, for kind of the viewer who has never heard of ketamine, has no idea how it's used for therapy, can you give us a little bit of a rundown about ketamine infusion therapy and kind of how it's administered, specifically how it helps with mental health, and then kind of we can just roll from there. I just want you to give us a little foundation of understanding.
Absolutely. So, ketamine is actually a very well known and old drug. It was developed in the 1960s, originally as an anesthetic. It is very similar in structure to PCP or phencyclidine, which was also developed as an anesthetic, but has too many side effects. Ketamine is like a watered down version of that for anesthesia. At higher doses and anesthetic doses, it causes sedation, and it also causes anxiolysis, which helps with pain. It means it decreases pain. However, ketamine is the only type of drug in its class, which is known as a dissociative anesthetic. And that is how it translates into mental health, because the dissociative part is where a lot of the transformative experience happens that helps with depressive states. So the dissociative state is really where the transformative experience happens, and that happens at a sub-anesthetic level, meaning you don't get the sedative properties of ketamine, but you get a dissociative state, which is a state outside of the ordinary mind. It's a deeper journey inward. It allows for some ego dissolution, which our ego tends to be the wall that we put up that defends our deepest, darkest self from everything that the world is throwing at it. And a lot of people are able to view their traumas in a completely different experience through that state. So it helps to accelerate a psychological and even a possibly a spiritual growth, and it helps to accelerate therapy as well. So it's a very unique medication. It is not um, considered a psychedelic. It is considered a dissociative, though it has a lot of similarities with other psychedelic drugs.
Okay, so there's definitely been this movement in spiritual communities and kind of different types of retreats that do use psilocybin or MDMA or different kinds of psychedelics. Can you give me a better understanding of how psychedelic is different than dissociative?
Absolutely. So psychedelics are deeply rooted in plant medicines like psilocybin, which is a mushroom, ayahuasca, which is a type of root and vine combination tea, um, ibogaine, there's cactus, mescaline. So all of these create an ordinary state of mind. And the research there is really fantastic. There's a lot of research being done, um, especially with maps. I'm sure a lot of people have heard of maps at this point. Um, and it's very, very promising. And so I know that the FDA is very close to approving it as part of therapy. And there's a lot of work being done to move legislation forward to help legalize it for therapeutics use. So that would include allowing therapists to administer it and then give it during therapy. Now, these types of psychedelics are usually taken, and the experience tends to be much larger, meaning it takes a longer time. A lot of times, these psychedelics take anywhere from 8 to 12 hours to fully metabolize. And so you're in that journey the entire time. And it's really important to have the proper set and setting for those experiences. And what that means is the set is the mindset that you're coming in with. And so having the proper preparation for that is very important. And then having a good, safe setting where any sort of anything that comes up is going to be able to be managed by the people there with you is also really important. So that is something that protocols are being worked on, research is being done, and we are just scratching the surface of it. It's very, very promising and very exciting. Now, the difference with ketamine is that it's the only thing that's available right now that is similar to a psychedelic, but is legal and available. And so this is like scratching the surface. This is a step in that direction. It's very powerful. Ketamine is, and very effective for a lot of people. But I do think that there's going to be a lot more alternative options in the future.
Okay, so with ketamine, do you have that same kind of like hallucinating kind of experience? Or I know sometimes when people do ayahuasca, psilocybin, they'll kind of go into not just a different mind state, but they'll look at plants and see them differently, and they'll hear things or experience different dimensions, kind of an expansive mind. um, is that what happens on ketamine as well, or is that dissociative experience different than hallucinating and kind of experiencing different dimensions?
It's it's similar but different, and it's so hard to describe. I have tried to describe it every time I consult with a patient, and at the end, I always ask, "So, how would you describe it to someone else?" And it's impossible. So, I'm going to do my best. But it really is a loss of time and space. A lot of people will reference feeling like they've traveled around the world 3 times, or they'll feel like they've been sitting in a chair for 14 years. So, but you don't have necessarily as much of the hallucinogenic effects that you would have with, let's say, ayahuasca or psilocybin. Um, Generally, people are able to really journey inward, journey into their own thoughts and into their own minds and see what comes up. I like to say that it's like watching a movie, and it's like watching a movie of your own life. And sometimes you might realize, oh, there's something scary coming towards me, a thought or a time and a place that I don't know if I'm ready to explore yet in this state. Um, but a lot of people find that just being able to come to terms with that is very therapeutic. And then they can take that into their next therapy session and discuss it in that environment. And I find that with ketamine, also depending on how you take it and how it's given at the clinic that people go to, we tend to be in a lot more control with ketamine, meaning in most places it's an IV infusion. So they will start an IV and they'll get you hooked up to a pump that has the ketamine in it. And it will be infused over a very specific time period, most often 40 to 60 minutes. If at any point the person feels like they're getting too anxious or they're anxious about the treatment, anxious getting started with it, anxious during the treatment, we can turn it off. And as soon as we turn it off, the medication's metabolized within 10 minutes, meaning all of those dissociative effects start to go away almost immediately. So when given in that form, in the intravenous form, it's very controlled, and you have 100% bioavailability, meaning the milligrams that is given, the dose that is given is 100% what you're getting. Now, ketamine can also be given in different forms. A lot of people may have heard of S-ketamine, which is a nasal spray, which is a different version of it. That is very helpful for some people as a bridge between infusions as well, or a maintenance. It can also be taken as a troche, which is a sublingual tab. And that is much less bioavailability because anytime you take something by mouth, it goes through the entire digestive process and gets broken down before your body actually gets to use the drug. And so that tends to work really well with CAP, which is ketamine assisted psychotherapy, where you take the troche and you're having therapy right there in that session. And the ketamine troche just kind of dials it down just a little bit, dials the ego down just a little bit to where you're able to have a much deeper therapy experience than you might have otherwise had.
That's so interesting, and it overlaps with a model of therapy that I use in my practice called internal family systems
Yeah.
theory.
Mhm.
And for those viewers who aren't familiar with that, I do have some videos about that you can watch. But essentially, it's sort of identifying true self and then identifying the parts of ourselves that kind of block us from our real essence and from our real knowing. And so it sounds like that's what the ketamine helps with, is sort of helping those barriers, those shields, those old patterns, those
Absolutely.
parts that, maybe those parts are trying to protect you or doing their best to keep you safe, but you don't really need to be kept safe in that moment. And there isn't really a stimulus that may have originated from, your childhood or a long time ago. So lowering those walls to have access to that self sounds kind of like what you're talking about with this ketamine process.
Yes, absolutely. In fact, the main therapist that we work with, Jill, has been really wonderful. And she also is trained in IFS. And we have found that that seems to work really well in conjunction with ketamine treatment for anxiety.
Mhm.
Because anxiety comes from a different place, and sometimes it's much harder to treat with ketamine. And so having that therapeutic background and being able to come at it from a different angle is really, really important. So I'm very thankful to her and all of her knowledge and being able to provide that sort of support.
Certainly. I imagine that it's helpful to have the ketamine therapy administered with a therapist, in that person's life, so that whatever happens in the experience can then be kind of processed and made meaningful rather than just an experience that comes and goes and leaves you sort of without deeper insight, right? So, can you maybe speak to how often would you do a ketamine infusion and sort of what would be the ideal balance between ketamine and psychotherapy?
Yeah, so that's a great question. My philosophy for how ketamine therapy works best is within a therapeutic container. So, meaning we usually schedule a series of infusions for mood treatments. It tends to be a series of 6 infusions within 2 to 3 weeks. But we check in after three and we take a look and we say, okay, is this working? Is this helping at all? Because if it doesn't really help after 3 infusions, then it might be a good idea to either reassess and see if three more or one more or five more is going to be good, or if it's something different. Maybe it's needing more robust therapeutic care. Maybe it's taking a look at hormone balancing. Maybe it's nutritional support, and maybe it's back to evaluation and management by a psychiatrist and different medications. So
Mhm.
um, we generally do the 6 infusions because we have seen the best response between utilizing the ketamine in addition to therapy. And the way that I like to do it with our therapist is we have our therapists do a pre infusion prep session, which is where they help you get into the right mindset and maybe even set intentions for the session. And you could even bring something grounding or something that makes you feel safe and comfortable. And that preparatory session really helps our clients feel comfortable with their first ketamine experience. Really depends on where the patient is coming from. Somebody might already have a previous psychedelic experience, in which case they might be more comfortable with ketamine to begin with, or maybe even starting at a higher dose. So it really depends, and every treatment is individualized. But most people tend to respond really well with the first 3 treatments with ketamine. Then we do an integration session after the third infusion. And if we continue to do another three, we'll do another integration therapy session at the end of the six. And then I usually encourage all clients to just continue their therapy as needed. And if they need to come back for a booster, we can get that scheduled. Most of my clients don't need to come back for a booster. If they do, it might be 2 months out or 6 months out. But everybody's very different, and everybody's mental health history is going to really um, tell us what we need to do and how we need to approach it. And the most important thing is to do it safely.
Mhm. Is there an addiction component with using ketamine in I think I mean that in two ways. So first is if you have somebody who is prone to addiction or who has already had substance abuse, is that a red flag in terms of doing ketamine assisted therapy? And then my second question would be, is ketamine an addictive substance? And if so, how do you work with your clients so that they don't form an addiction?
That's a great question. Unfortunately, ketamine has been abused on the street. The issue with any sort of abuse is that you never really know what you're getting. And a lot of times when it's abused, it's in powder form. So you're taking a powder, you don't know how many milligrams it is. The Any studies that have shown there to be negative side effects from ketamine, which would be cystitis or bladder issues and frequency and urgency, have been from frequent abusers of ketamine. However, ketamine is, they say, as addictive as a cup of coffee. So it does not have addictive properties. It is not like an opioid. It is not an opioid at all, even though it helps with pain. It works on a completely different set of neurotransmitters. And and so I have never witnessed anybody who has come in wanting ketamine therapy for a mental health condition and then going out and seeking it as a party drug to continue this type of experience. I've never seen that happen. There have been a lot of studies who have attempted to see whether that has become a trend, and it has not. In general, everyone that comes in for ketamine therapy is truly seeking to fix an issue that they're having, a low state and a stressful state. issues with their life, and wanting to better themselves. They're not trying to make themselves worse. Um, with addictive states, there's definitely a feedback loop component that is, that we don't have control over in our brains that happens in those addictive states. With alcohol addiction, ketamine has actually been shown to help break those patterns and those ruminations. And so it has been shown to work quite effectively, especially in conjunction with NAD plus therapy, nicotinamide adenine dinucleotide, hard to say, tongue twister. But NAD plus has been shown to be very effective in addictive states. It is a coenzyme molecule that is within all of our cells, and it helps with cell turnover and it helps with energy generation for cells. And some people have found very, very good results with decreasing cravings that addictive states have. And so sometimes that in combination with ketamine therapy will actually be will have a very good response.
Yeah, that sounds really interesting. And it's nice to hear that people are coming to you for clinical purposes and that their intention is just really genuine to be
Mhm.
using this as, a helpful agent in their healing. I think that ultimately that's what we want, right? Because I think sometimes when people abuse psychedelics or ketamine on the street, it's really a cry for help and it is trying to help themselves in a way, but it's not facilitated in that kind of mindset environment that you were explaining before with the safety. Just curious about, how does ketamine co-interact with other substances that might already be in that person's body, whether they're taking an antidepressant or they use supplements, or maybe they do drink alcohol, maybe they use marijuana. Is it important that someone be at a baseline where they don't have any other substances in their system when they work with you, or can you include this as part of kind of their maintenance plan for how they take care of their health?
So I don't recommend any medication changes. So if somebody is already taking an SSRI or SNRI, that's going to be continued to be managed by their physician, whoever prescribed that for them. There is no contraindication in starting ketamine therapy and being on any other antidepressants. There are some people who might not respond as well if they're on very high dose benzodiazepines. Also, Lyrica tends to just decrease the effectiveness of ketamine. So we do a full assessment. We take a deep dive into the background and what medications that they're on. There are no major red flags or no major contraindications that I would say you got to stop this in order to start. But I also would work very closely with the client's physician and make sure that they're aware that they're looking for ketamine therapy to help with their depression or the mental health condition, and that they are okay with it. So that way we have a very open communication about how they're doing.
I think it's really important for different healthcare providers to coordinate care. And so that seems like a really valuable piece, so that your clients have the support of a whole team of people who care about them and who are working together to support them in finding that wellness. So I'm happy to hear that.
Yeah, absolutely. I think that that is one of the most important things that we can do. I find that a lot of clients come to us seeking ketamine therapy without already having seen a psychiatrist or even being in regular psychotherapy. And so they kind of read all of the positive reviews and success stories online about ketamine, and they're like, "Oh man, I just want something different, something to work." Um and so they come, and I don't move forward with ketamine infusion unless I know that there's a good therapeutic background. And so at the beginning, when we first started, therapy was kind of like optional. Like, if you're comfortable with therapy, we can set you up, but now it's mandatory. I want you to have that prep session. I want you to have that integration session because ultimately the goal is for you to not need ketamine in the future. And in order to make that long lasting therapeutic change, it's going to come from creating new habits and creating better habits, stopping the ruminations that are happening during depressive states and stressful, anxious states. And ketamine will do that, but it's more of a key that unlocks the door than a silver bullet. So, what we find on the other side of that door is what we're going to have to deal with in therapy. And ketamine may not necessarily be able to tell you how to fix that thing, that scary thing, or therapy comes in and helps with that. So coordinating care is very important. There are also specific medical conditions that we look for when screening individuals, where we know that ketamine will not be a very good option for them.
Sounds like your practice is incredibly thoughtful, very deep in acknowledgement that you are working with a powerful substance. And it sounds like, as you're talking about the ketamine, that you really have sort of a reverence for how powerful it is and a respect for that. And you're using your medical background and your training and your thoughtfulness and your client centered care to really protect people and to help to guide people into the best possible experience. And I'm really thrilled to just hear all the ways that you support your clients before, during, and after this process, because it is a powerful substance. And so the people who come to you may or may not know that, but it sounds like you've taken a lot of responsibility to truly understand and respect what you're working with and to educate and support within that.
Thank you. I really appreciate it. I definitely find this drug to be very powerful in the best of ways, but as it's our duty to make sure that we are doing the right thing, we are doing the right thing by our clients. And ketamine is such a unique medication in its application for mental health. Truly, when used in a mental health setting, the expertise is on the mental health practitioner. And anesthesiologists are not trained in mental health. That is not our area of expertise. And I tell my patients all the time, I'm not a therapist. I'm here to make sure that the ketamine experience is safe for you. I'm comfortable with the dosing strategy and how we work through your journey of infusions and increase the dose in order to maintain a dissociative state, which is the therapeutic transformative state. And but on the other end of it is the therapy aspect of it, which is where the integration comes in, which is the long term, where the long term healing comes in. And ultimately, that's what we're looking for. That's what we want. We don't want somebody to be coming back consistently just for the high or the experience. We want this to be the type of treatment that is transformative and that gets you to a happier, healthier mental state.
The key unlocking the door rather than the silver bullet, which I think is, that was such a, for me, when you said that, that was such a strong and poignant metaphor that this isn't going to cure anything for you. This is going to open space for you to do your work. And so
Exactly.
having somebody who's willing to dig deep and maybe face some challenges and do their work, I think that is a really key component to any form of healing, whether you're using ketamine or not, right? It's the healing process is something that we each have to do within ourselves. And so a readiness and a willingness to face what's inside is imperative.
Yeah, absolutely. And I'm very encouraged about where all of this is going to go, with the integration of psychedelic medicine, with just taking a more whole body, whole mind approach to ourselves. I think we have so many different ways that we are unlocking our wellness and our best future selves. There's so many different avenues that we can take with this, and looking at it from a wider lens is really important.
Mhm. Yeah, and it's interesting to just hear you talk about how it's been a medicine that's been around a long time, but this application of it is sort of in its younger stages, and there's all this growth potential ahead.
Absolutely. It's very exciting.
If someone were interested in this, but maybe they weren't ready yet to come in for infusions, do you have books or just resources that you could offer to our viewers to just delve a little deeper in with educating themselves?
Yeah, I actually created a free downloadable PDF file for anyone that wants more information on ketamine. It's on our website, aspenketamincenter.com. And you just put in your name and email, and it comes up as a little downloadable. And it basically is a great introduction to ketamine therapy. If anyone's interested in taking a look, you're welcome to go to the website and download it. It's just completely informational.
In closing today, is there anything about your practice that just is exciting? Any offerings that you want to let us know about and just share?
I'm just very excited to collaborate more and more with therapists. I'm meeting more people locally that are interested in moving the psychedelic movement forward for therapeutic use and purpose, and getting them initiated into ketamine therapy. And what that looks like is kind of a first step there. So I'm very excited to collaborate more with other experts in the field. I'm also interested in speaking to nutritional counseling and bringing in nutritional counseling for this reason as well. So we're really excited. We're expanding in lots of different ways and trying to bring more resources and into the therapeutic aspect. I think that's the best way to do it. So
Yeah, it sounds like you are doing an amazing job of
thank you.
sort of sharing all of the education that you have and the knowledge and connecting it. And you've used the word integration several times with the ketamine process, but it sounds like you are also really integrating yourself into the mental health network and the different communities. And so it's just been really wonderful speaking with you today. And I feel like I really learned a lot. I think you do a beautiful job explaining the work you do and putting it into terms that anyone could really understand and listen to. So, thank you so much for being with me today. And maybe someday down the road, we'll do a follow up if people have more questions. But for today, um, maybe this is a good place for us to close.
Perfect. Thank you so much. It's been such a pleasure and an honor speaking with you.
Thank you. You too. Take good care.